Namaste to you. We continue our discussions, cancer cure as is the main heading. We are in conversation for the last many days, making video clips with the advices and experiences shared from Dr. CP Mathew, sir, the most experienced oncologist in India for sure. And today we thought of discussing about, it's one of those, if you may see it like this, it's one of the chapters of his book. And since we don't have an English version of this book, it's important that at least we make some glimpses of the very key points. So today's discussion is about food, the role of food in the prevention of oncology situation, or even maintaining it fairly well, or even part of the cure process, how important it is, be it the vegetarianism or be it the role of the yogurt as it is called. And Ayurveda has a different take on that also. It will all be clubbed together in this video clip.
The human digestive system is meant for herbal diet. Herbivorous animals, the anatomy of gastrointestinal system, and also the physiology of gastrointestinal system is exactly that of cow or ox. That is pure herbivorous animals. The length of the intestine, the secretions of the intestine, all these are in favor of herbal food. Now, naturally, herbivorous animals don't get cancer. That is a very, very important point. So also, men who are pure vegetarians, certain communities, Namburis, Brahmins, and such pure vegetarians do not get cancer at all. There are so many studies in the world, especially in countries like Israel and India. The cancer depends on the diet. Now, if those communities where they follow very strict vegetarianism, very seldom you get cancer. That is a very, very important point. Now, my discussion is about diet and cancer. Now, why there is no cancer in vegetarian people? Because the carcinogen, the enzyme that is responsible for cancer, carcinogen is present only in animal protein, never in vegetable protein. That is why vegetarians are protected from cancer. Now, only those who eat animal protein, meat, fish, etc., get cancer because carcinogen, the enzyme, is present only in animal protein. This is a very, very important point. I don't think there is any teaching about this in the medical schools about importance of diet in the prevention of cancer.
And we had also, of course, come to the knowledge, it's very much in the book of sir, is that about, I think it's Mr. Elias Michael Koff, in the book called Prolongation of Life, published in 1908, it's more than 100 years now, how he was mentioning the importance of yogurt, the importance of the lactobacillus bulgaricus and such very commonly known information, and how it is somehow forgotten in our normal practice. In the science of Ayurveda, there is a definite role for what is called takra, and the simple English word for that would be buttermilk. Having said that, it's kind of a misnomer term. There is no much of milk left out. You get the milk, you convert into a dahi, or you call it curd or yogurt, and then what you do is basically you skip off or skim off the fatty content of it, and then it becomes, you call it, in some places of North India you call it lassi, sometimes you may call it chash, and the typical Sanskrit word would be takra, and in Kerala you may call it more, and you may even call it pulisheri, and the various terms which all, or you call it kadi in Gujarat. So anyway, these different nomenclatures were same food stuff basically, and it has a fantastic effect on the gastrointestinal system, wherein you convert the yogurt to much more easily digestible, we say buttermilk, and wherein you are ensuring that it's not about the lactobacillus kind of idea. It's also about the metabolism enhancement that Ayurveda very sufficiently narrates and very elaborately recommends to have this metabolic stimulant in the form of these different words we use with buttermilk. And this can always be seasoned to your taste and liking, be it with the haldi or the jeera or whatever kind of spices that suits your taste of the tongue. And this is why it is so much when I am in the OPD of Dr. CP Mathew sir, there's one thing he would be so much assertively communicating to every patient is he would say have yogurt. And some people who have difficulty to digest it or they find it not easy to have 3 to 4 cups, they dilute it and they make it buttermilk, which still does good to the system. But milk is not generally recommended, isn't it?
No,
Milk
yes,
is,
it
yeah,
is so.
yeah, milk is, I have seen myself, he would never recommend for milk. And on top of that, we have our own share of challenges with milk these days and times. The milk we get in the market, well, it has its own quality and that is not always agreeable to us, but we have no other choices. So anyway, this kind of a judicious usage helps a lot in the diet factor of patients with cancer. And I think a good majority of non-vegetarianism, if converted to vegetarianism, would perhaps help in the context of colon cancer. So do you think the colon cancers are more these days and times?
Yes, because animal protein, there is it is otherwise called a low residue diet. Low residue diet means there is nothing to be thrown out. So there actually, I happened to stay with a European priest for some time. Now he used to go to the lavatory only once a month or once a week. That too after consumption of castor oil, because he was so addicted to constipation. Because in vegetarianism, actually, it is otherwise called anti-cancer diet. Vegetarian diet is an anti-cancer diet. It's otherwise called that because there is high residue. It's a high residue diet. Vegetarian diet is a high residue diet, whereas non-vegetarian diet is a very, very low residue diet. That is the difference between. So, non-veg people are habitually constipated, whereas vegetarian people they have their motions every day. So the whatever toxin that is produced in the colon is washed out every day, and whereas the non-veg people it is accumulated in the colon. You know, colon is actually the reservoir of final fecal matter, and days and weeks it remains in the colon. And you know the gases that are produced as hydrogen peroxide, methane, all these things, hydrogen sulfide, all these gases are there. They are so irritant to the colon. You know, the highest incidence of cancer of the colon is in non-veg diet people, especially in America. They are we Indians are now the Indians are so slowly going into that same type of habit. So that is very, very important. The constipation in non-veg diet and pure vegetarian diet as an anti-constipation diet.
So in case if you are looking at this video clip for the first time, the best way to get the best out of this series of videos is to of course subscribe it. And the diaries that you see here in this context here, they are basically from 1985 onwards. And as I would have been communicating in the previous video clips too, these diaries are the experiences of sufferings, of success, and even of also failure of all those terminally ill cancer patients who left us a big legacy of the message of integration of different systems of medicines for better life or better cure or better relief. If nothing else, at least a painless departure from this world for cancer patients. So these are the diaries that you see, and we make it a point that we display it in every video clip we have.